Let me bring in Bruce Josten. He's the Executive Vice President of the Chamber of Commerce. They have a perspective on this. Sir, your organization, the Chamber, has been buying ads opposing a public option. The CBO, the Congressional Budget Office, has done a study indicating that, in fact, the number of those in private health plans would go up if there was a public option. They also say that about 11 million people would choose a public option, which is far fewer than opponents say would be the case.
Thank you, David. We do oppose a public option because, in part, because of what you just touched on earlier. We have a long history of both Medicare and Medicaid under-reimbursing doctors and hospitals, 70 to 78% of what private payers do. Those under-reimbursements ultimately then are cost-shifted back to the premium payers, which are the companies in America that you've pointed out in your show are providing health care coverage to the vast majority of Americans, over 160 million of them. Now, with respect to the need for insurance reform and health care reform, the business community is one of the strongest proponents, and we have been for several years. We ran, in fact, ads last year calling for reform and more choices and bending the cost curve on health care. But when you under-reimburse and it gets cost-shifted and you've got doctors practicing defensive medicine out of fear of liability, we're corrupting the system. So if we're going to have a level playing field, a public plan is an uneven playing field. It'll destabilize private insurance, and independent researchers in the healthcare analytical area, as well as CBO, have expressed concerns that many employees could migrate away from employer-sponsored cover because of that competitive cost advantage initially with federal government backstopping.
All right, Mr. Josten, thank you very much. Senator Daschle?
Well, David, I think the basic question is, are we building this new system for the American people or for the insurance companies? I mean, that's really the key question. How will they be better served? We have a public option for Medicare Part D today. 6% of the people participate. I mean, there is a very small percentage of people that, for all kinds of reasons, have chosen the public plan when it comes to drugs. I think the argument is kind of interesting. It is that, well, this is going to be so popular that people are going to leave the private sector and go to the public sector. Well, that's what choice is all about. But I think what we've got to do is to ensure that we're going to level the playing field. We're going to make sure that the competition is fair. But you've got a choice. Either you're going to have the competition or you're going to have a regulatory framework within which the private insurance industry is going to have to work.
Big difference in what he said, though, on Medicare Part D. You allowed nationwide competition of insurance.
But that's what we're doing with this.
No, you're not. You're regionalizing it. Look at the House bill. Look at the Senate bill. You're regionalizing. You're making it a state base. The difference is in New Jersey, the same thing that costs you $600 in Missouri costs $9,000. It's because of mandates. And what we need, and we all agree, we need more competition among the insurance industry. But the way to get it is to open it up.
All right. I want to ask you about a point of news, though, here today. If the president is willing to accept reform without a public plan, without a public option, if he can live with strong, cooperatives that allow some choice for consumers, can that attract more bipartisan support? Will Republicans sign on?
Well, I think that there is potential for that. I think the other thing that we need to remember is inside the House bill and inside the Senate bill is 87 new government programs requiring well over 150,000 new federal employees. We can't accept that because that is government management of health care and not individual management. I want to make one other point on comparative effectiveness. The problem with comparative effectiveness is it divides the loyalty of the physician away from the patient. It takes what is important for you as my patient, and all of a sudden I'm looking over here because somebody here is telling me what I can do rather than what I know. Rather than what I know needs to be done in your best interest.
Let me just say, this is just a Consumer Reports on best practices. That's what we're talking about with regard to health care. Consumer Reports.
Then why would they block a prohibition?
Right, hold on. I want to ask Senator Daschle to respond. We're almost out of time.
Just to your point about bipartisanship, the Bipartisan Policy Center, Bob Dole, Howard Baker, and I put together a plan that did exactly what we're talking about. They were very, very supportive of it. And so I think there's a very good opportunity for us to produce a bipartisan product.
You said it was 50-50 whether you get reform. Is that still your view?
That's correct.
Still your view, only 50-50. Rachel, let me ask you this question. What will progressives, what will liberals, the president's base, accept as reform? Do the independent voters he's courting out in Colorado and Montana need to be placated, a big part of his base, or not?
I mean, I don't think liberals monolithically feel one thing about this. I think most liberals would probably prefer a single-payer system, honestly. But ultimately, if the president decides that he's going to go with a reform effort that doesn't include a public option, what he will have done is spent a ton of political capital, riled up an incredibly angry right-wing base who's been told that this is a plot to kill grandma, and he will have achieved something that doesn't change health care very much and that doesn't save us very much money and won't do very much for the American people. It's not a very good thing to spend a lot of political capital on.
Tactically, I know you're opposed to this philosophically, ideologically. Tactically, you were part of that fight in 93, 94. You said it was crucial for Republicans taking over the House. Does the president achieve something this time?
No, I don't think he does, and I think the fact that he's now signaling his willingness to back off on the public option and put in the surrogate, which is the government-sponsored cooperatives, which is what we probably will be calling them Freddie Mad or Fannie Mad, as GSEs, as we know in the finance industry, are a horrible exercise in impudent practices. But it's interesting. When we argued for years that we should have private cooperatives where associations could put together these purchasing risk pooling things, all the liberals were against that. Now if we have government-sponsored cooperatives, they're for it. But don't make any mistake about that government-sponsored cooperative.
I'm going to let that be the last word.